Hello. So, in the second part of acidity or acid reflux, I'll tell you about I'll concentrate mainly on the patient complaint and examination finding. So, first part I have given a small introduction and the aggravating factors, and the third part I'll cover mainly about the investigations, and the last is the most important one which I'll deal with the treatment. So, here I'll tell you the patient complaints. So, the second part, let us start. So, these patients, they may present either to a general physician or a general practitioner or a general physician or to ENT, or some of them they may go directly to the gastroenterologist too. So, when these patients they come to us in ENT, most of them they complain, they have a discomfort in the throat which is a vague complaint, and some of them they say there is a foreign body sensation like in the throat. They are not able to explain properly, and they say something is troubling me in the throat. It is continuous to, and they may have associated voice change on and off. And this hawking sensation, which is the clearing of the throat like this, that becomes a habit for them. Even if the acidity has been reduced by some medication, they keep on doing it. Some of them they say they have this belching sensation, and some of them they complain about heaviness of the abdomen soon after meals. So these patients, those who complain about the heaviness in the abdomen soon after meals, if we ask them, do you have a pain at the same time? They say yes. Do you have pain during bending forwards? They say yes. These two things is very characteristic of gastritis. Gastritis which can precipitate gastric reflux too. Few patients they present with dry cough. There is no sputum production, but dry irritating cough which hampers their normal activity, even the sleep. And very rarely they may have choking spells too. That may be one of the reasons why they come to us. And one of the very common complaint is they say chest discomfort or burning sensation. And few of them they say when they get up in the morning, as soon as they get up, they have a change of taste sensation in the tongue, and the heaviness of the head, and the whole day they will be restless, and they are not able to work normally, and they are not able to sleep also normally, and this all results in indigestion, and it winds up in it can end up with constipation too. So these are the several complaints, and patient can present with any one of these or a combination of all of this. Now coming to the examination, we'll start with a nasopharyngo-laryngoscopy. It's a flexible endoscopy where the whole procedure, it hardly takes 5 minutes, and we don't need any special precaution for that, preparation for this. So this endoscope, it will pass through the nose, way behind the nose, to examine the part behind the nose as well as the part behind the tongue, the oral pharynx and the voice box. As I have mentioned, it hardly takes 5 to 7 minutes, and the findings which we get will be the whole area behind the nose up to the vocal cord, it will be red in color, and the redness depends upon the severity of the gastroesophageal reflux. This will be the common finding. So I have explained to you the common presentation and the examination finding. So please do watch the third part where I'll brief about the necessary related investigations. Thank you so much.